Okay, well, welcome everyone. I think we'll get started. It's now 12:32. I'd like to welcome everybody to the Alberta Association on Gerontology, Living Well, Enhancing Seniors Care and Services speaker series. Today's session is Living Well in Supportive Housing. I'm Lynn Mansell, a member of AAG and your co-host. Before we start, just a few housekeeping details. We're using Zoom webinar, so for those who haven't used it before, everyone is muted and you will not be seen on camera. And we will be recording the session, but since you won't be seen on camera or your voice won't be shown, then we won't be using any of your private information. If you're having any difficulties, please put something in the chat. I see it is operational, but we'll use the Q&A box for the questions that may arise during the session and during the Q&A session at the end. Our speakers will talk for about 15 minutes, maybe 20. And when they're finished, we'll have the Q&A period and we'll address as many questions as we can before the end of the 30-minute session. There shouldn't be any concern with Zoom bombing because we're not showing anyone else's screen except for that of the speakers, and the attendees can't be heard. But if we are targeted anyway, we may have to end the session. So I'm going to now turn it over to our speakers who are going to introduce themselves. We have Bruce West and Ralph Hubele. So over to Bruce first.
Thanks, Lynn, and good afternoon, everyone. Thanks for giving up part of your lunch break to join in our presentation. It's wonderful to see this many participants online. My name is Bruce West. I'm a recovering civil servant. I spent 30 years with the government of Alberta in both policy development and program delivery roles. During most of my career, I focused on social and affordable housing with an emphasis on Alberta's continuing care system toward the end of my time with government. In retirement, I've kept my interest in continuing care issues alive through involvement in a number of nonprofit boards and committees, and through COVID, through numerous Zoom meetings and webinars. I'm partnering today with a longtime colleague of mine, Ralph Hubele, and he will introduce himself shortly. Just a little bit of background first. This is a second session. You're probably familiar with this already, but AAG hosted a symposium in November 2019 to discuss a future vision and policy and service priorities for Alberta seniors in 2030. The Alberta government received the report and asked AAG for recommendations on short-term actions that could be taken toward this vision. AAG formed working groups, which resulted in a subsequent paper entitled Older Albertans Living Well, a call to action to enhance care and services. Quality care and services are required regardless of where older Albertans live, whether it's in their own home, in the community, in supportive housing settings, or in long-term care. And Ralph and I were part of the working group that explored short-term ideas to promote living well in supportive housing. To start our talk, Ralph will give you a bit of a primer in supportive housing, and also, I should say more correctly, probably called supportive living. I'll then give you a brief summary of the actions AAG recommended to promote living well in supportive housing. So I'll stop sharing my screen and turn it over to Ralph.
Where the heck, how do I do that? Okay, let's see. Thank you very much, Bruce. Good afternoon. As Bruce mentioned, my name is Ralph Hubele, and I've been involved in the field of seniors housing for the past 35 years. Today, I would like to share with you my perspective on supportive living in Alberta. Essentially, what is supportive living? It's both a philosophy and approach for providing services within a housing environment. It provides settings where people can maintain as much control over their lives as possible while receiving the supports they need to maintain their activities of daily living. It can be found in all types of tenure, room rental, room and board, life lease, and ownership. And building types also vary widely from a single special needs individual living with a host family to specifically designed facilities of 300 or 50 plus private living units. There are some fundamental principles that reflect supportive living. That includes maximizing independence of the residents, respect for individuality, maximize control of their environment, maximize resident decision-making, maximize privacy, and flexibility of environments to accommodating changing needs of residents. Looking at the significant growth this housing option has experienced over the past few decades, I think there are several reasons feeding this growth. The absolute number of seniors is increasing. With increasing availability of support services, there is an ability to live longer independently with chronic conditions in the community. Changing lifestyles and expectations of an aging population. They want more choices. They prefer independence. Higher expectations regarding services. The financial situation for some seniors has improved. Some are afford alternative private options available in the community. Research conducted by HS indicates that an intermediate level of care rather than long-term care would be appropriate for the majority of people waiting for continuing care. As such, designated supportive living spaces are being added where access to 24-hour personal and professional nursing care is available. And the increasing number of supportive living spaces and community-based alternatives to long-term care will provide Albertans with greater choices of where to live and receive services. The types of supportive living have been categorized into 4 levels, as seen here. As one moves to the higher levels, it reflects noticeable declines in the ability of residents to direct their own care and manage activities of daily living. The building forms that support supportive living can take is fairly wide. For example, it can range from group homes, senior citizen lodge program, private pay lodges, private pay supportive living facilities, and designated supportive living facilities. The continuing care system spans a wide spectrum of service delivery for clients, from home care being delivered to residents' homes, to supportive living for those with personal care and daily living needs, and to individuals with complex support and care needs in long-term care. I would now like to briefly take a look at one form of supportive living that has been extensively used by Alberta Health Services, designated supportive living. Historically, the provincial government has provided capital grants to assist operators to build and operate supportive living facilities. Alberta Health Services contracts with these operators to provide personal care and health services to residents assessed as requiring designated supporting living level of care. Room and board charges for these units are limited by agreement to the current rate for private rooms and long-term care, currently about $2,120 per month. For low-income residents, subsidies are available through Alberta Seniors Benefits to ensure that this rate is affordable and allows residents to have $315 for personal expenses. All rooms are private with some availability of shared occupancy suites for couples. Health services agreements are entered into between Alberta Health Services and the operator. Resident access to these units is determined by Alberta Health Services, which undertakes an assessment of the individual in terms of the most appropriate setting for them to receive their support services. And facilities must meet design standards specified by Alberta Health Services and Alberta Health. Residents in contracted spaces need assistance in performing daily living tasks, performing unscheduled personal care activities, and have healthcare needs which can be met on a scheduled basis. Designated supportive living spaces may be for a portion or all of the supportive living spaces in a specific facility. Some facilities offer an integrated setting where, in addition to the designated spaces, non-designated spaces occupied by private pay individuals may be eligible for home care supports delivered by the site operator. Alberta Health Services and Alberta Health are also partnering with seniors and housing in the redevelopment and replacement of older lodges in the province. Designated supportive living capacity is being incorporated into these new facilities to accommodate residents with higher levels of care need. Designated supportive living facilities share some common characteristics. In terms of the architectural design requirements have been established that emphasize accessible design, safety, and residential character. They also have to be licensed and regulated by the Supportive Living Accommodation Licensing Act and regulations. They're contracted by Alberta Health Services for placement and supported individuals. Residents pay for their room and board, which is limited to the maximum rate for private room rate as previously mentioned. And they may be owned and operated by not-for-profit groups, groups with religious affiliations, private for-profit groups, or in special cases, Alberta Health Services. Finally, I would like to mention some trends that have been observed in the development of supportive living in Alberta and elsewhere. One such trend is integrated projects, a campus of facilities, a campus of care and facilities that offers varying levels of housing and supports to accommodate different levels of residential abilities. Also, the emergence of multi-generational projects that have a mix of housing types, including families with children, singles, and seniors. There's also the emergence of shared housing, such as the Golden Girls concept. Can be with an aging owner looking for a lodger to provide support, or friends renting a home together and supporting each other. Another emerging type is virtual villages. This involves concentrations of seniors living in existing communities coming together to organize and deliver support services for themselves in the community. Also, co-housing projects, purpose-built intentional housing projects that offer independent living with communal spaces to promote community and support amongst the owners, which can include seniors. Also, there's been the emergence of themed supportive housing communities, focusing on residents with common interests such as art, music, or physical activities, or common needs such as the butterfly dementia concept. And a building design that is reflective of learnings from COVID, which has resulted in things such as the promotion of smaller residential settings of 10 to 14 units with access to all of the activities of daily living within that environment, private rooms with private washrooms, reduction in touchable surfaces, enhanced internet capacity to promote and support virtual health and families and residents connecting better, and changes in staffing models. Thank you for the opportunity to present my perceptions on supportive living. And now back to Bruce.
Thanks, Ralph. Okay, so I'll talk a little bit about the recommendations that our committee made to the government. We acknowledge that most Albertans will prefer to live in their own homes in the community, hopefully getting appropriate services through supports like home care. Over the last couple of decades, supportive housing, though, has become an attractive alternative for people who need some additional support, personal support and healthcare supports to help them maintain their independence. And while the Vision 2030 report noted that only 5% of older adults currently live in supportive housing, there is an increasing need and demand, especially for designated supportive living. Our portion of the AAG's report was divided into a general recommendation, a directional policy recommendation, and 4 immediate actions that could begin in the coming fiscal year. So they want a short-term approach at actions. Our general recommendation was to explore ways to increase the supply of all types of supportive housing. But our preferred alternative, and this is a particular interest to me, our preferred alternative would be to promote the development of multi-level supportive housing projects in which a portion of the suites could be contracted designated supportive living and a portion could be private housing. Residents whose care needs are assessed at a DSL level could move into a rent-controlled DSL space or remain in their own suite and pay market rent, but receive publicly funded DSL services, as Ralph said, through home care, but delivered by the provider, based on their assessed needs. There are examples of this model in place already, and we feel it should be expanded to other sites. From a broad policy perspective, this means promoting the development of a wide range of supportive housing options to meet a diverse needs, housing needs and support needs in the community as Albertans age. It also means ensuring that there's a stable, capable workforce, providing some housing support and health services to make supportive housing an attractive living option. And going forward, the efficiency and effectiveness of supportive housing settings will be enhanced by the appropriate use of existing and new technologies. So getting into our immediate actions, our first one was to increase the supply of the affordable supportive housing options. Back in the 1990s and early 2000s, the Alberta government introduced a number of capital funding initiatives to modernize the Aging Senior Citizens Lodge program and to promote the development of new supportive housing projects by the public, nonprofit, and private sectors. These projects generally involved a government assessment of community need and the provision of a capital grant, usually up to about 50% of construction costs, to help make the project viable at affordable rates for future residents. Over the years, these programs fostered the development of thousands of supportive housing units and the upgrading and replacement of many older lodge projects. We proposed reintroducing these capital grant programs in needy areas across the province, but based on new models of supportive living, as Ralph pointed out, that would allow older couples, for example, to age together even when their health and personal support needs differ. Quality staffing is key to promoting a good living environment in supportive housing. And we learned a lot about that during the pandemic. It highlighted many of the deficiencies in current staffing models over the continuing care sector, including in supportive housing. Healthcare aides on average earn less than $20 an hour. Most don't work full-time hours and therefore are not eligible for benefits like sick leave. Some healthcare aides had to work split shifts to accommodate high needs in the facility, the high need times in the facility. And healthcare aides working in hospital, for example, generally receive higher pay than those in continuing care. That may lead to a high turnover in continuing care settings, which makes it hard for residents to develop trusting relationships with their caregivers. Our recommendation is to continue the trend during the pandemic to pay these staff higher wages and benefits, and to reduce the need for staff to work in multiple settings in order to earn a reasonable annual income. We therefore recommended that more effort be put into, we also recommended that more effort be put into in-service training and professional development. Recently, the College of Licensed Practical Nurses of Alberta proposed regulating healthcare aides, which would give them a professional recognition. There are benefits for public safety through this approach, but it does bring an added financial burden to healthcare aides, which really does need to be explored further. We also recommended the increased use of technology in supportive housing. Jurisdictions like Denmark have actively employed technological solutions to improve the quality of life in continuing care clients and to ease the workload on care providers. Alberta has undertaken a number of pilot projects to explore the benefits of employing new technologies in community-based settings. Examples include wander management systems, personal medical response programs, medication management systems. While many of these projects demonstrated benefits, few have moved beyond the pilot project stage. Alberta needs to take steps to support the use of assistive technologies in supportive housing. And our last recommendation related to pandemic planning, and this is common across the entire continuing care system. We had lots of experiences in the pandemic. While all continuing care providers are required to establish policies and procedures for outbreak prevention, identification, management, and control, the COVID pandemic highlighted vulnerability for continuing care residents to infectious diseases. So in future, we want all continuing care settings serving vulnerable people to have an approved plan to respond to pandemic outbreaks. But very importantly, in developing these plans, residents and their families have to be consulted. And while protecting the health of residents is paramount, any plan must consider their quality of life as well. Family and friends as essential care partners play a key role in providing emotional support and comfort to residents. They advocate on behalf of them, and they often lessen the burden on paid staff by providing essential personal care. So any outbreak plan has to incorporate ways of involving such key care partners in each resident's care while respecting the principles of outbreak prevention. So that's our presentation. We hope that there's been some questions that have been raised, and we'd be happy to answer them. And there's our contact information if you'd like to get hold of us.
Okay, we have a couple of questions so far. One was, I think for Ralph, when you talked about the emerging trends, did you have a slide that listed them? And if, oh, there we are. Thank you. Second question was, what consumer protections are available for supportive housing or living units? And I assume the clients who live in them.
I'm not, Ralph, I'm not sure I fully understand what consumer protections mean.
Well, I'm going to guess that it might mean monitoring the quality of the housing as well as the monitoring of the care that's provided.
Yeah, so there's the Social Facility Licensing Act and regulations. They initially came into being in 2009. I think they were updated in 2015. So there are inspectors that go out, and there is licensing in place so that they have to meet specific identified standards for their operations. And there's also a complaint process that they can respond to, that either Alberta Health Services through will respond, or the regulatory agency, Alberta Health, will do it. And
one of the benefits of the Supportive Living Accommodation Licensing Act is that it applies not just to publicly funded settings, it also applies to any private or publicly owned facility that houses 3 or more people, 4 or more people, I should say. And so, unlike, for example, the health standards, which only apply to publicly funded health settings, all supported living settings are subject to the Act, the inspections, and there's also a public reporting site as well that indicates which facilities have had deficiencies and whether those deficiencies have been corrected.
Another question, what are the range or some of the costs incurred by residents for the supplemental goods and services in supportive housing?
Yeah, one of the...
so that could include...
go ahead, Ralph. No, go ahead.
Go ahead, please.
Okay.
So basically that would be incontinence products. That could be medications. That could be extra, if they wanted extra support, so somebody to come and sit with them at night or things like that, you know, something like that. Sometimes for transportation to appointments and things like that, there may be a cost or charge for doing that. If they're,
yeah, and I would say one of the inconsistencies in the supportive living settings versus the long-term care system, for example, is that you're responsible for your own medications, and other supplies that you may require in a supportive living setting, even designated supportive living, and so that makes it a little bit different than the than long-term care settings, and it's one of the areas that maybe needs to be explored. And really, the same goes for home care as well. If we're to make this an equitable system and equally attractive across the board. I mean, nobody asks to go into a long-term care setting, but nevertheless, with that guarantee of $315 available, which is also, I guess, allowed in supportive living, but it does mean that you have extra costs that you have to pay for in a supportive environment.
Just as a follow-up on the previous question, the Social Care Licensing Act that you mentioned, does that also protect individuals in terms of their occupancy, like the Landlord and Tenant Act might?
I don't believe that the Landlord Tenant Act applies to supportive living, just because of the way that it's safe. But probably what would be more important would be the contract that you sign with the operator with regards to the occupancy in that building. What is laid out there in terms of reasons for maybe be required to leave or yeah, things.
I'd just like to ask if somebody could get back to me in the chat box. Can you see the Q&As? Because there's a reason I'm asking is there's a survey of family caregivers of supportive living residents that's being done by Dr. Matthias Hubele from University of Alberta, and the link was posted in the Q&A box. If not, we can send you that Yeah, so you can't see the Q&A box. Thank you. So we can put that link, whoever put it in the Q&A box, if you could put it in the chat box and make sure it says that it's for everyone. Oh, Corinne says she can see it.
Yeah, I can see it.
Oh, you can.
I
Okay.
want to make just one clarification. And Ralph and I maybe have to discuss this offline. There's something called the Social Care Facilities Licensing Act, but I think that applies to children's services. The one that applies to supportive living is the Supportive Living Accommodation Licensing Act.
That's true.
All
Yeah.
the other things we've said are the same. That the key is that you're going into supportive living because you have both a health and a housing and a health need, and so that's why the Landlord and Tenant Act wouldn't apply, because your health condition may change, making it inappropriate for you to continue living safely in that setting.
So there's a note that's been also posted that says public reporting of compliance with accommodation standards can be found at the standards and licensing.alberta.ca site.
Great, good, thanks.
Right.
And the and if you can't see the continuing care survey, or if you haven't heard about the facility-based continuing care survey that's being done by Alberta Health, we can send you that link as well, and encourage you to respond to it, as AAG is doing.
Yes, quite comprehensive.
Yeah. Another question, is there any support for family members being cared for by family in a private home setting? So I guess it's independent living. Is there anything available to support the family members?
Not to my knowledge. That's certainly one of the recommendations that we've been making as part of the survey, that the continuing care survey. You have an opportunity to comment on that as to whether you think funding should actually be available for family members to provide support to people in a home environment or in a supportive living environment. So that would be one of the future directions or possible future trends.
And it's something done in other countries, like I think the Netherlands, they have, that kind of a program where the family members can be reimbursed for taking care of it. And it may be something that you could, the self-managed care program could expand its scope to incorporate that into it.
And if people want to find out more about services for family caregivers, they can contact the Alberta Caregivers Association or Google it. And they have a lot of services there. Another comment, people who have considerable health needs may choose to be in a private user pay facility, and they may depend on quality health care, but the health care standards don't apply to these homes. What assurances would they have of good health care? Who monitors this? So I assume this means private care and private facility.
Potentially the professional association involved and who's ever providing that care, if it's, for example, a registered nurse, but there isn't to my knowledge, a government oversight of privately provided healthcare services or personal care services.
Oh. I'm just going to check the chat box to see if there's anything in there. No. Any other questions? I have one that came in before the session, and it has to do with what you think the future role of seniors lodges in Alberta should be.
Ralph?
Oh, well, I think that, as I mentioned in my presentation, Alberta Health Services and Alberta Health are working with seniors and housing with regards to the Seniors Lodge program in Alberta. And in their replacement or upgrading of old facilities, we are looking at the opportunity to incorporate designated supportive living spaces in there as well, so that individuals that are in the lodge and basically will be able to age in place in those kinds of settings. It offers us a flexibility, offers choices to individuals. So I guess, again, someone that may not qualify for a designated supportive living level of support can still take advantage of what the lodges have to offer. My own personal opinion is over time, the demand for lodges is starting to disappear because of what is available in the community or what is available through the other supportive living options kind of thing. So it's still there and it offers choices, but I don't think it's, it's a growing industry.
Okay, I think our last question before we have to end is to what extent are those new trends for housing currently available? The ones you shared, Ralph, such as the Golden Girls housing model.
It's interesting. There have been attempts in Calgary, for instance. The Calgary Seniors Resource Society for a while had a service for several years where they would match people that had capacity in their homes with people in the community that were looking for that kind of accommodation. Unfortunately, they ran out of funding. I think it's still a good opportunity. It's just it's not there right now. Virtual villages in Calgary, there's a fellow named Barry Pendergast has developed a virtual village in the Oak Ridge community where they have about 25% of the population in that community is seniors. They didn't even have a seniors club. They're going gangbusters and setting up a variety of programs, being connected virtually and develop services and things for the seniors community. Again, co-housing, that's another kind of approach that there's a project under development in Calgary that will be the second one that has that kind of approach to it. So I think there's, they're out there. Some of them are not well publicized or identified, but they do exist. And I think you'll start to see more and more of them as people look for other types of options rather than the traditional ones that we come up with today.
Okay, well, I think we have to end. On behalf of AAG and everybody who attended today, thank you very much, Ralph and Bruce, for your presentation. Just to note, you will be getting through email a few questions about the session and an opportunity to connect with us about further feedback. And so we'd appreciate your response when you get the email. And just a reminder that next Thursday, we'll be talking about living well in long-term care. So we hope you can join us for that. Thanks, everybody.
Thanks, everyone.
Bye.